Hi, everyone. I'm Shivan Sarna. Very glad to be with you today. We have the incredible Dr. Allison Siebecker. Say hi, Dr. Siebecker.
Hello, everyone.
Who is going to be teaching us today about small intestine bacterial overgrowth and IMO, and how to prevent relapse. So you're in the right place. I do have a couple of housekeeping requests. Let me get that up there. And come on in. It's good to have you all. Let's see. I already did this in practice, but I'm doing it again. My little kitty cat with the butterfly on its nose has become my friend. And now we're going to share my screen. And okay, here you go. So please be nice or be gone. This is our philosophy at our, at our hearts and in our businesses and in our practice, whatever you want to call what we're up to, our projects. So I have no expectations that there will be a problem. Just know that is a mantra we live by because we like to practice the golden rule. The hardest part of the webinar, please do turn off your distractions. This is such valuable information that we are giving to you at no charge, and we're very proud to be able to do that and honored. But please do respect the work and yourself by turning off all distractions. It's your time, right? And then for the chat box, that's for your technical issues. And when I say, hey, what do you think of this? Then go ahead and type it in because we really do want to know. And the Q&A box is for questions. Do try to keep those questions as succinct as possible because I am reading them and it's hard for me to read a lot of text, but of course I want to know your situation. So organizing it as much as possible is super helpful. So today is the last day of the trainings, but the learning can continue if you decide to join us for our SIBO Recovery Roadmap course that we've been touching on. For those of you that are new, that is the incredible Dr. Allison Siebecker, world-renowned, award-winning SIBO specialist. It's a Lifetime Achievement Award from her peers. And it cracks me up because she's so young, and what an honor. And, Dr. Siebecker is not only a special doctor and friend to me, certainly, and to this community, but she's also a very powerful advocate. And she is really excelling in connecting so many different groups together. And as in traditional doctors, as well as in naturopath healers of all sorts. I just got a note from my team that I have not had us live on Facebook. You know what? I'm not going to do that right now. We'll put the recording in there. Okay. It's just been very busy, and that's one less place for us to have to focus right now, but we will put the recording in there. So that's me. I'm Shivan Sarna. Hello. I'm your host, the founder of SIBO SOS, and that's my book, Healing SIBO. It's floating around here. Dr. Siebecker read every single word and wrote the foreword. What an honor. And this is my story and also all the information I learned from her and also the other SIBO specialists that have participated in our projects like the SIBO SOS Summit 1 and 2 and the, on and on, all these projects. I think I'm on my 9th summit right now for a variety of topics. So trust me, $20 well spent on the book. If you're like, okay, I just want a book. There you go. And also an award-winning actor read it. Dr. Siebecker and I are friends and like cats. There you go. So this is us after we recorded the SIBO Recovery Roadmap course. We were very relieved. We decided to give ourselves a treat and go out to the Bay here in Florida. And again, a little background about me. This is just me on TV in case you're like, I think I may have seen her. If you like home shopping, then you probably have. Dr. Siebecker and I at a conference, you may for SIBO, you may recognize some faces. Here's our team. There's our videographer, Miles. And I swear they're like an old married couple, like they met. And I was like, okay, I'll just leave now because you guys are getting along so well. So stay until the end. It's a different graphic, but what you'll be receiving is the Prokinetics chart, as well as Dr. Siebecker's favorite recipe for cake and the SIBO Recovery Roadmap that will guide you through the algorithm that we've been talking about. Okay, that is all of the housekeeping. We will get out of sharing my screen and stop sharing. Here we go. All right. So next up, what we want to do is to just talk about what you're going to be learning today and the problem. So many people relapse. So many people do not use Prokinetics properly, including doctors, a lot of doctors, and that's not slamming doctors. Literally, there was a thread in the Facebook group today slamming doctors, and I stopped it. I was like, I'll have none of that. Thank you very much. Back to be nice or be kind. Not all doctors are terrible. Not all doctors are great, right? And then there's the, neutrals, I would say, that are just trying to help their patients. They're overloaded. God bless the world with what we've been going through in this health crisis. But the main thing is that you find someone who you connect with to a certain extent. The main thing is that they know what they're doing and that they're there to support you. And if you are like Jean, who was in one of our sessions after the webinar the other day, she's like, it's terrible. He treats me like dirt. I'm like, get a new doctor, because you don't want that language associated with your doctor. So anyway, a lot of well-meaning, highly trained doctors and practitioners do not know about the information we're going to be sharing with you today from Dr. Siebecker. So whether you're new or whether you've attended all of these courses and you've done the summits and you've read the book and you've done the SIBO Recovery Roadmap Course and the Pro course, don't worry, we're still going to be sharing information as great reminders, but also I think it's going to be very revealing. So if you've ever had chronic SIBO or relapsed or would like to prevent that, this is what you are going to be learning today. And Dr. Siebecker and I are totally devoted to making sure that this information gets out to the world as much as possible. So that is why we have done these workshops and why we created the courses and why we are so glad that you're here. So the statistics are in. 2/3 of SIBO cases will relapse, and that the average time the relapse will occur is about 2.5 months. So you may have a negative SIBO breath test. You got gorgeous, feeling good, looking good, 2.5 months. Not to, rain on anyone's parade if you are in that sweet spot right now, but many people will face a relapse. That's why investigating the underlying cause is so important. And that you can do things to make relapse happen less frequently and remissions last longer. So the promise for this webinar is that we are going to help people understand this and give you information that you can take actionable steps on. So how to treat the relapses, how to prevent relapses, and so much more. So stay until the end. You'll get a Prokinetic handout, as well as the algorithm itself and the cake recipe, which has been a big hit, I have to say. And you know my story if you've watched these webinars, but what you may not know is that I now feel great. I do have chronic SIBO. Well, I do have a chronic underlying condition, I think is a good way of saying that too. And that is because I had food poisoning and I have the antibodies. So for me, I'm constantly vigilant about taking my Prokinetic and about making sure that I'm doing as much as I can to be as SIBO resistant and resilient as possible. And also remember that a managed condition that's chronic is 100% times better than an unmanaged chronic condition. I proved that to myself. That's words I would never have really thought of saying before. But since working with Dr. Siebecker and all of these transformations in my own awareness and health, I am happy. I'm like, yeah, hello, life. I missed you. So know that there is hope. Okay. Even if you have chronic SIBO, there is hope. Even if your underlying cause isn't curable at the moment, there is hope. So the other thing that was really pivotal for me and that gave me that hope was that I knew what to do next. There was confidence in what I was going to do next. There was no more confusion. There was no more SIBO panic. There was no more stress. And that unto itself is so worth it, right? Like, how many of you feel like SIBO increases your stress? Go ahead and pop that into the chat if you can relate to that. Go ahead, just pop it in, pop it on in. Yep. Do you feel, I mean, maybe some people don't feel stressed from it. Yeah, you do. Okay. Yep. Okay. And of course, stress, thank you. Yeah, on and on and on. Just know that you're not alone. Okay. So do what you can to take good care of yourself. Don't let this condition make you bitter, and don't let it exhaust you to the point of not wanting to do that next step. And sometimes you have to take a break too, as Dr. Siebecker and I have talked about multiple times. But also there's sometimes when you have to put your flag in the sand or whatever they say and say, okay, I'm going to take it on. And that's really what these are all about. It's also why Dr. Siebecker and I created the SIBO Recovery Roadmap Course, which we will be talking about after the end of the lesson. It's a brief view of it. This is not an infomercial for the course. We don't like that. We've gone to webinars where it's like, hey, winkety winkety. We're really not going to be talking about what we told you we were going to be talking about. We're going to talk about this course. We tell you exactly what we're going to be talking about in the free training. And then I take a few minutes to explain the course because we've had so many requests for ongoing education and additional resources, which we will discuss. So, and then after that, we get into the Q&As, which I know is the favorite part for so many of us. So the course is, by the way, very organized, not overwhelming. And that is really the course I wish I had had when I first found out that I had SIBO. And that's why it has been created. So Dr. Siebecker, for new people, would you please tell us, and as a reminder to the ones that are regulars, tell us about your story briefly.
Yeah, it's very similar to yours, which is that essentially I got IBS at about 5 years old from food poisoning, just like you. And so we have that in common. But I didn't even know it was IBS. I thought I had bloating, I had constipation, I had terrible, terrible abdominal pain. I didn't even call it anything most of my growing up, I just was I was a person with food sensitivities. Everything bothered me. I mean, I remember when I was like 8 years old, I was drinking prune juice, and which then later when you find out you have SIBO, it actually has a lot of sugar alcohols that can create more bloating, and it never helped my constipation. And back then that was prune juice was reserved for the elderly, and I was like 8, and I was like, what's going on? So anyway, much later, it was identified that I had, I officially got the diagnosis of IBS, and then it was I identified that I had SIBO. Obviously, I learned about it. And that's the thing is that I got incredible help from the treatments for SIBO, incredible help that I learned myself. And that lit the fire for me to want to help other people. Obviously, if there was something that could help me, that means there's something that could help other people. So that's what this is all about, is that, that's what it taught me more than anything, is that information is power. Once I had the information, I was able to feel better. And so that's what I want to share with you today.
Well, Dr. Siebecker and I feel better. We want you to feel better. And I want you to just take a moment, because it's a fire hose of information. Just take a moment. Take a breath with me, yoga teacher Shivan emerging here, and just relax, drop your shoulders. Just take a moment to draw in the intention and put that out into the universe that you can be better. And that's what this whole series has been all about. That's what this whole mission is about. And I just want you to imagine that and taste it, touch it, feel it. I know for me, I was so fatigued. I was so uncomfortable. I was so paranoid that people who saw me on TV would think I was pregnant or, whatever, fat, whatever. Just being on TV is very stressful to begin with. And when I started to feel better, it was literally like a weight was lifted. It can be done. So I'm going to let Dr. Siebecker take over right now, because I've covered all my points and I want to get to the teaching. This is the fastest we've gotten to it so far, so we can do extra questions and answers at the end. We will be finishing promptly at 2, so we can quickly get the recording out to you as soon as possible. And if you stay until the end, you'll get that recording for sure and the handout. So thank you very much. All right. Thanks, Dr. Siebecker. Take it away.
Okay, my pleasure. I'm going to share my screen. Okay, here we go. Okay, are you seeing the right view there, Shivan, of my full screen with a flow chart?
Are. Yeah, it's beautiful.
Okay, so in the first webinar in this series, I went over this SIBO treatment flow chart in detail. And today I'm going to focus on the prevention and relapse area, and I've got a big circle here to indicate that. And prokinetics are going to be part of that topic. We'll get to that eventually. And I just want to point out, they're listed twice here. They're here and they're here. And last webinar, I went over webinar 2 in the series. I went over this area. Oh, let me turn my cursor into a laser pointer. I love it. I went over this area right here. So now we're doing the circled area. So we know that 1/3 of SIBO cases are not chronic, and 2/3 of cases relapse and are thus chronic. And these statistics come from the Target 3 trial of 2,500 patients. So it's a majority of cases that will relapse, unfortunately, 2/3, at least statistically. And this is actually consistent with the IBS data. We know that 60 to 70% of IBS cases are SIBO, and IBS is defined as a chronic condition that waxes and wanes. So the question is, why are so many cases chronic? Well, here are some quotes to help explain it. SIBO is often a secondary disease, and unless the underlying problem is addressed and well controlled, the chance of recurrence remains high. However, in the majority of cases, elimination of the underlying cause is not possible. And that comes from Drs. Pimentel, Rezai, and Rao. And from Drs. King and Tosks, most conditions predisposing to bacterial overgrowth are lifelong once present. So the issue is that there are many currently incurable diseases that cause SIBO. And I stress currently because there are slews of doctors around the globe always working on incurable diseases to try to find cures. But some example would be the food poisoning. So food poisoning is the main cause of SIBO, more so SIBO than EMO, but can cause EMO too. And Dr. Pimentel is actively working to find a cure for that. Another would be Ehlers-Danlos syndrome, diabetes, and Hashimoto's hypothyroid. All of these are causes of SIBO that it is not known how to cure at this time. Or another reason why there could be so much chronic relapsing SIBO could be that the underlying condition is challenging to eliminate. So some examples of that would be Lyme disease. It can be done, but it usually takes a year or two, or sometimes more, and you have to go to somebody who's really good at it. Or abdominal adhesions. These are like internal scar bands that can occur from injury, inflammation, trauma, surgery. And they're not the easiest thing to get rid of. We have surgical ways and non-surgical ways. But the non-surgical ways, there's these amazing people that do it, but they're limited in number who are able to do that. Another reason why there's so much chronic SIBO is maybe the underlying cause, the condition that is causing someone's SIBO hasn't been identified yet. That's kind of a more practical thing of what is adding to this statistic. And I actually think this applies to a majority of SIBO cases that we don't know yet what the cause of their SIBO is, or you don't know yet. And once identified, it may turn out to be an incurable condition, but we don't know yet. Maybe it's not. Maybe it is curable. Or maybe there was insufficient treatment and they may not even be chronic. So they stopped SIBO treatment when 1 or 2 rounds didn't help symptoms, and now they have a chronic case, is what they're thinking in their mind. They're thinking that they're a tough case, that treatments don't work, and that they can't be helped. None of which can be judged by 1 or 2 treatments that didn't reduce symptoms. So I went over this in both of the previous webinars, webinar 1 and 2. So the point here is that the high amount of SIBO cases that have relapses and are chronic are not due to a failure of standard SIBO treatment protocols. They actually work really well. It's usually something deeper than that. We can get those tests negative unless there's something like toxic mold illness, but it's usually something deeper than that. And ultimately, really, it's about whether we can eliminate the underlying cause. So what are underlying causes of SIBO? There are a huge amount of possible underlying causes for SIBO. And this chart is a narrowed down version of of the causes, and I call this noteworthy causes and risk factors. And even this narrowed down chart is quite daunting. There's still a lot of things to have to go through and figure out, do you have this or do you not? Now, next question is, so first we answered why. Why is so much of the cases chronic? Now, this is what everyone wants to know. Can SIBO be cured? The good news is that statistically, for 1/3 of cases, it can. 1/3 of SIBO cases are not chronic. This means that these people will not relapse. So once they eradicate SIBO and get their test negative, they're done. Now, it may take several treatment rounds to do that. It may not happen after the first treatment round, but once it's gone, it stays gone. And if it's gone and it doesn't relapse, that means it's cured. And that's for 1/3 of cases. For the 2/3, if the underlying cause can be identified, and if it's a condition that can be eliminated, then that should stop the relapses. So once the antimicrobials have eradicated the SIBO, it won't come back. And once the SIBO is gone and it doesn't relapse, then that means that's what cures. So the answer is yes, SIBO can be cured, just not in everyone. If there's an incurable underlying cause, then it's likely to come back, but this doesn't mean, key point, that you can't feel well or can't feel really good. There are sort of two types of relapses. There's relapse after eradication, and that's what defines SIBO as being chronic. And then there's the relapses or backsliding between treatment rounds while you're trying to get an initial test negative. But today here, that's when you need to do more treatment rounds, and I'm really focusing here on after eradication. So what are the timeframes for this? As Shivan mentioned, the statistics are about 2.5 months, but actually there's a much broader window. I'd say anywhere from 2 months to about 1 year after we get a test negative, because the statistics for 2.5 months really are about the very first time you get your test negative. Then you're more likely, well, not you, but just statistically, it's more likely for people to relapse more quickly. But what we see is over time, the relapses become more frequent. So what I mean is that, okay, so let's say a person relapses at 2.5 or 3 months, we treat it, and then now they don't relapse for 6 months. And then when they do, we treat that. And meanwhile, we're giving them management strategies during those remission periods. And so over time, as there are SIBO relapses, they get farther and farther apart. This is the norm. That is the norm. Now, what do you do if you get a relapse? So if you relapse, what do you do? It's indicated here on the algorithm. So at the bottom, let me use my little laser pointer here. This is like you've gotten better, you've moved to prevention, and I'm going to cover this in a minute, but now you've relapsed. So you try to figure out, investigate what your underlying cause is, and then you follow these arrows you retreat. So this big purple arrow here, you come back up around, and it's simple. You just retreat it with antimicrobials. Again, the way you did in the beginning of the treatment. You pick from the 3 antimicrobial treatment types and use the protocol for your gas type. So you just treat it the original way it was treated. Okay, the next question I want to address is overall, how to deal with chronic SIBO, how to prevent relapses, and how to manage recurrent SIBO symptoms. So we have several methods for this. And the first I've already mentioned, which is to find and eliminate the underlying cause if possible. The next is the SIBO diet. SIBO diets really have their best use for symptom relief. They are challenging, they can be, depending upon how it's being applied, because there are a lot of restrictions. We have to restrict foods, and that can be very hard. And so we have to be careful not to restrict too much. But putting that aside, they're excellent at symptomatic help. And I think where they shine, they're the most helpful for people with chronic SIBO. People with chronic SIBO usually need to be on some kind of a SIBO diet ongoing. Now, also included under this heading would be meal spacing, so no snacking between meals. Another method we can use are supplements. We have many supplements that help manage SIBO symptoms. And I have that handout called SIBO Symptomatic Relief Suggestions, which we've been giving in each webinar. And I know, Shivan, you didn't mention it in the beginning of this webinar. I don't know if you're away from your desk right now.
No, I'm here. I'm here.
Okay, but I think our intention is to make sure everyone is getting that handout, that symptomatic relief handout.
You're absolutely correct. Absolutely.
And actually, I'll just in case anyone wasn't at the, let me just show it to you. At the previous webinars, this is what it looks like. And so it's just all these supplements you can buy yourself that are targeted to help bloating, constipation, pain, and here's diarrhea, nausea, acid reflux, just general indigestion. I hope you could see that when I switch screens here.
Yes, absolutely.
Okay, I'm coming back to where I was at. So those are supplements. Okay, and the final method that we use is prokinetics, and that's what I'm going to focus on now. So prokinetics are medicines that amplify and coordinate gastrointestinal motility. And they've been studied for SIBO by Dr. Pimentel and shown to extend the remission time after successful eradication, which means that they can prevent relapse. So what this means is that we can gain 2.5 to 6 months of remission time by using a prokinetic, because the average relapse time of 2 months can be extended to 4.5 to 8 months with a prokinetic, which is just astounding. Astounding rates, like incredible. So the use of this medicine, from it, we could gain extra 2.5 to 6 months. Basically, they can prevent relapse for 4.5 to 8 months by adding them. So because prokinetics can prevent relapse, at least for some good amount of time, that means that they can help manage recurrent SIBO symptoms, relapsing symptoms, because they delay the relapse of those symptoms. Now, what is the purpose of the prokinetic really? Underneath, what are we trying to do? They're used to stimulate the migrating motor complex, which is the #1 prevention against SIBO. And this occurs during fasting. So what it is it's a downward motility within the small intestine that sweeps the small intestine clear of bacteria and microbes on a daily basis, because it occurs during fasting. So on a daily basis, that would be between meals, if we're not snacking or drinking caloric beverages consistently throughout the intermeal period, and overnight while we're sleeping, unless you get up in the middle of the night to eat. And then at that point, that would turn it off. So this happens whenever we are not eating, right? Or not drinking caloric beverages. It's just there as a housekeeper. It's called a housekeeper wave. Clear out any debris, leftover food, and any accumulating microbes. Sweep them down into the large intestine, where then they can be eliminated. So it's the body's #1 prevention against SIBO. And this is what we're doing with prokinetics. We take them, the way we dose them and take them is before bed to stimulate the migrating motor complex overnight while we're fasting. So we clear out any bacteria or archaea that are starting to reaccumulate potentially after we've cleared the SIBO each night. And that's how it works to prevent SIBO from coming back and prolong the remission time. Okay, now when do we start them? We start them pretty much right after we're done with our antimicrobial treatment. And for many of us, we know we need multiple rounds of treatment to get the test negative. So this is a key point, is you go on them right away to prevent that backsliding I mentioned earlier, just in case you need multiple rounds. So when would this be? It would be, you stop the treatment, the next day you're off the treatment that night. So day 1 after antimicrobial treatment. You could wait a few days. You certainly could. You could, I would say 2 to 5 days, but not too much longer than that, because you really want to get in there and just make sure you're holding any gains you've just made. And logistically, this means you need to be ready with whatever prokinetic you're going to be taking to start right after you stop your antimicrobial treatment. So it means you need to be prepared with your plan and you know what prokinetic you're going to take and have it at the ready. Okay, so what are the prokinetics? What do we use? We use low-dose erythromycin, low-dose prucalopride, and low-dose naltrexone. And that is also called LDN. And these are prescription. So we have several prescription prokinetics we can use. And we have natural or herbal prokinetics. And these are Iberogast, which is a 7-herb combination formula that's in a liquid, ginger root, and the ginger containing prokinetic formulas. And all of these are available to purchase online over the counter. And these two charts, we will give you a version of these charts as a handout at the end of the webinar. Okay, what are the ginger containing prokinetic formulas? These are things like ModalPro, Prokine, Motility Activator, etc. And these all have ginger root. Ginger root's an excellent prokinetic, particularly for the stomach and small intestine. Many of these, most of these actually also have 5-HTP in them. That also has some evidence that it might help as a prokinetic. So these can all be ordered online over the counter. And I think we have a link to my Fullscript dispensary, which allows you to get a discount. And if so, Clarissa, if you can pop that into the chat, that would be great.
I think it is a 15% discount.
15%.
That's really nice. Yes.
Yeah. It's my practitioner account and I'm sharing it with all of you. Okay, so duration, how long do we take these for once you've started them? We typically recommend about a minimum of 3 months after the SIBO's been eradicated to get past that initial first relapse window of 2 to 2.5 months. So, so to get yourself past that time when you might have relapsed. However, you can take them ongoing for longer, and many people with these incurable underlying causes will just need to be on a prokinetic long-term ongoing. You can stop a prokinetic at any time that you wish. The only risk is that you might relapse. However, this is something we do with lots of people, is that we stop them to see how will they go. And many people are very good and don't need it after some time. And so, as I was saying, you go on a prokinetic after an antimicrobial, but then sometimes you need another round of antimicrobials in your whole treatment journey here. Is it okay to be on the prokinetic during that next antimicrobial treatment round? And the answer is yes, you absolutely can be on it for the next treatment round, but you don't need to be on it. So it is fine to stop. It is fine to continue it. The general recommendation is to stop it and then restart it after your antimicrobial treatment. The only exception to this is LDN. We usually keep this one going the whole time. So the most important thing is to be on the prokinetic between the antimicrobial treatment rounds. Okay, now some key points. Prokinetics are not laxatives. These two types of medicines are very easily confused. So prokinetics are used in SIBO diarrhea patients. Many people have slow motility in slow migrating motor complex in the small intestine that gives them their SIBO, but then they have diarrhea, and often this translates to fast large intestine transit. So the prokinetics are meant to correct the slow small intestine motility, and what they're correcting isn't the kind of motion that gives bowel movements. It's in the small intestine, and it's just that cleansing housekeeping wave, pushing the bacteria or archaea down. So they have different functions and purposes. Prokinetics amplify and coordinate gastrointestinal motility, whereas a laxative's definition and function is all about bowel movements. They are meant to loosen stool and produce a bowel movement, which is not the function of a prokinetic. So, on the other hand, if by chance you've ever taken a prokinetic and it has given diarrhea and you don't want that, then just lower the dose. If you recall from the earlier slide, the pharmaceutical prokinetics are all given in low dose. So even if you start a low dose and by chance it gives you diarrhea, then you just lower the dose or switch to a different prokinetic. And I always just like to point out that all medicines, almost every medicine has on its warning area on its label, could cause diarrhea or stomach upset. So anything could cause diarrhea in anyone. So it isn't meant to do that here. And if by chance it happens, you could just choose a different prokinetic or lower the dose. Now, the reverse is also true, that laxatives are not prokinetics. So laxatives are things like magnesium. That's an osmotic laxative, or high dose vitamin C, or the prescription laxatives, prosecretory agents like Linzess or Amitiza or Trulance. And again, I cannot remember. Yesterday, I was discussing this in the other webinar. I cannot remember their drug names at the moment, but these are the US branded names for these. These laxatives don't stimulate the migrating motor complex, which means we cannot use them as prokinetics because they're not. They're laxatives. These two classes of medicines aren't the same. So if a person needs to be on a laxative, they have to take that laxative and also their prokinetic, because the prokinetic is stimulating the small intestine migrating motor complex. Another key point is that natural prokinetics and LDN, that's low dose naltrexone prescription, often aren't strong enough for SIBO relapse prevention, especially in the more chronic and more challenging cases. And for those, we really need prucalopride or erythromycin for best effectiveness. Almost always when I hear a complaint that prokinetics aren't useful or aren't helping, usually they're using, that person or that practitioner has prescribed natural options, the herbal options, and they have never tried the prescription options. And I just want to say that it is in the category of prokinetics, it's actually hard to find a good and strong and effective enough prokinetic. Like gastroenterologists, they need these medicines for many motility diseases that there are. And they search, there's always a search for the best prokinetics, the safest prokinetics. So it's not at all surprising that the natural ones aren't enough, at least for some cases. Now, in other cases, they are. We use them all the time. It's just if you're thinking, if you're sensing or feeling that you're not getting enough effectiveness, that's when you then can consider the prescription options. And another key point is that diet and prokinetics are essential preventions within the whole prevention of relapse part of our treatment protocol. And prevention of relapse is a key part of SIBO treatment. It's an absolute key part that so many people aren't doing. So diet and prokinetics really, really help to prevent relapse. Now, my focus today was on these prokinetics, this whole thing, but just here, these prokinetics, because this is such an extremely commonly missed step. So I'm hoping that now you know how helpful they can be. Well, Shivan, now that you said that, Shivan, I am finishing my presentation. So let's hope you were paying attention to everything, because I am now finishing. And this is the point I want to end on. I want to close on a super important point, which is that chronic doesn't mean that you can't feel well. We're discussing chronic relapsing SIBO, which when you first hear that sounds horrible, right? It sounds like, oh my God, I'm going to have this forever. But what you have to realize is it doesn't mean you can't feel well. It doesn't mean that you will be feeling as bad as your worst forever, or that your current symptoms will go on forever. Chronic doesn't mean that you can't feel better. So here's what we see when we manage chronic relapsing and we treat chronic relapsing SIBO. We usually see 80 to 90% symptom resolution. I talked about that in the first two webinars, and particularly webinar one, that what we're shooting for with our antimicrobial treatments is 90% symptom relief, right? So just remember that 90% symptom relief is absolutely possible, even 100%. Here's what we usually see as we use these treatments for a chronic relapsing person. With continued treatment over time, remissions become longer, right? So the relapses become less frequent. I mentioned that. The relapses themselves become less severe. When we retreat those relapses, those treatments work faster. Often we don't need to do, say, 4 weeks of herbal antibiotics or even 2 weeks of antibiotics. We're done in half the time. And we need less of the second line digestive supplements that manage symptoms. Also, the diet expands. We see this over and over. The diet can expand. And the key thing is quality of life increases. And I have had many SIBO patients tell me that they feel better during their, management period here than they did before they even got SIBO, which is astonishing, but it is actually true. I have had many patients tell me this. So this just basically means that with all of this that I just explained, that is the circumstance that occurs with chronic SIBO, right? So that's a pretty good situation. So in everything I just described, the person is not cured and they may face relapses, but this is pretty good. 90% symptom relief, remissions are longer, their quality of life is better than even before they got SIBO. So I also want to end the whole thing here saying that personally, just like Shivan, sharing my situation, I also have chronic SIBO and I feel really good. So I may get relapses and I have to manage a small amount of symptoms, but I manage them so that I don't have them, right? I don't have them and I feel really good. And this is after spending 35, 40, 45 years of suffering terribly with no help. So that's what's possible, even if you're a chronic case. And that's how I want to end this lecture. Oh, you're muted, Shivan.
About that. Thank you. Thank you very, very much, Dr. Siebecker. That is a beautiful presentation. And there are people who came in a little bit late who I know are, getting involved with SIBO and trying to figure their stuff out. And they're like, what's a prokinetic? So this just goes to show that people are not fluent in this idea of a prokinetic. And so I did type up what I could to explain it because I know they came in late. But, everything Dr. Siebecker said is exciting, right? Because I just tell you that for me, I can be an idiot sometimes. What can I say? I didn't believe in prokinetics. What do you mean you didn't believe in them, Shivan? So Dr. Siebecker came to my house when we were taping the SIBO Recovery Roadmap Course, and I had all these vitamins and supplements. And I was just like, Dr. Siebecker, I'm so overwhelmed. Can you just help me get these organized? And she was very patient, very kind, and she did. And we labeled stuff and put them in plastic big bags and stuff. And she was like, well, you're taking this, right? And it was prucalopride, it was Resilor, it was one of the prokinetics. And I was like, well, not really. And she was like, well, why not? Because this could really be helping you. And I was like, well, honestly, I forgot what it did. Right. So it was just like a little bit of a blind spot I had. And this was a long, long time ago. Well, sort of. And she's like, no, you need to take these. Come on now. And it totally changed my life, you guys and gals. It totally changed my life. That was such a big turning point for me. I knew what it did, but I didn't really. There was confusion in my brain, So please, I was doing another prokinetic at the time. I mean, I did understand the concepts, but I didn't understand that particular one. And that particular one for me was the game changer. So a little bit of ginger here and there was not for me. It did not help me the way it helps other people. And so I kind of gotten turned off and literally thought, well, I'm doing so many other things. I'm sure this is helping me. I started doing my Resilor, my prucalopride, and my whole life changed for the better. So that is my own personal experience. This isn't medical advice, as you all know. Please work with your physicians and your practitioners and as much DIY as you can with information, which is why we're doing this. But it's huge. I'm so excited that you know about this now.
And actually, Shivan, I just want to add, I wasn't going through all of the Prokinetics. I wasn't telling you about each one. And Shivan and I have this thing back and forth where I basically say they have personalities. Each Prokinetic has its own personality. But I wanted you all to just know something, which is that prucalopride is sort of like rifaximin in that it has all of these positive benefits. It actually fights a certain kind of cancer. It's just been shown to reduce brain fog and help cognition. So it happens to have all of these positive benefits as well. And and LDN also has amazing positive benefits. I saw somebody just wrote that in the chat, and it's true. It's an anti-inflammatory. It helps with mood dysregulation. It helps balance autoimmunity. So I did not go over all of the properties of the Prokinetics, but some of them are ginger. I mean, for goodness sakes, ginger's antioxidant. You know, oh my God, just on and on and on. These are actually wonderful medicines.
So I wanted to show you all, we showed you the link for the Fullscript. This is what it looks like. You get 15% off if you do decide to use it. I do. And that's prescription grade, or not prescription, professional grade supplements. And they also have the elemental diet in a variety of forms there. So that's really nice. Dr. Siebecker, I really appreciate you sharing that with everyone, because that's a nice savings right there. Really is. So that's what it looks like, but you have the link, and we'll put the link in the handout that, remember, you'll be getting at the end of the session, and you'll also receive the recordings at the within the next couple of hours. You know, you really seriously look in your spam and your junk, but also we are really tight. We've been really great about getting them out to you as soon as possible. Okay. The other thing that I wanted to show you, because I know there are a lot of students here from the SIBO Recovery Roadmap Course, is just to give you one quick reference point here. We did this yesterday also, just to pull it together. So this is the algorithm that Dr. Siebecker was teaching from down here. I don't have a annotation thing on, but so here you go. You click on Prokinetic and down here on the left, and then here are the lessons for in the SIBO Recovery Roadmap course. Did that just open up, Dr. Siebecker?
Yeah, I'm seeing it.
Oh, okay, great. So that's the course. If you're interested, this whole chart is explained. And what I had a brainstorm, I'm totally taking credit for this because it really was divine intervention moment, where I realized, wait a minute, we could put clickable links on the algorithm, and then it would send everybody to their lessons. And it was so like, it was just like a light bulb moment I had. And then our wonderful team behind the scenes, Clarissa, went to work and did a great job with it. So I wanted to share that with you for those of you who are in the course, or, you know, if you're just trying to connect the dots and haven't been in the course in a while. So the other things that I wanted to share with you before we get to the Q&A session with Dr. Siebecker is that the SIBO Recovery Roadmap, which is that diagram I just showed you, is also the name of the course that I wish that I had had when I started with my SIBO program. I asked Dr. Siebecker to create the course, and she was like, I'm in. And she did, and it's beautiful, and I host her through it, and we've been teaching you, she's been teaching you from it. So I just wanted to make sure that you realized it was available. If you're interested in going deeper and going further with your personal quest in your SIBO mission that you all have as you become your own digestion detectives, et cetera, et cetera. We do have a special for you right now, and that is, let me show it to you real quick. That is $200, $201 off to be exact. And then you also have, this is very, very important. Hold on, let me say it properly. You have 8 Q&As with Dr. Siebecker this year. So if you're already a student of this course and you're like, what, wait, don't worry, you're getting 6. So what's happened in this course is Dr. Siebecker and I did not want this to be a one and done. We wanted to evolve and grow as the body of knowledge about SIBO evolved and grows, thank goodness. So we update the course. So if any of you have already purchased it, don't worry, you automatically have those updates in your course. So go back, check it out. Last year, we didn't do a lot of Q&As. I can't remember if we did 1 or 2 or none. I really can't because it was a blur. But this year, and Dr. Siebecker was working on her book, and so that's why we didn't have access to her as much. So we wanted to make it up to you this year. And so if you already are a member of the course, you are with us for the duration. In 2022, you will get 6 Q&As. So there you go. I know that's a good deal for you. If you are signing up today, then you get 8. So you're getting the extra 2, which is really cool. We're about to do Q&As and you're going to see how wonderful Dr. Siebecker is at answering those questions. So you're really good at it.
Let's
You
hope.
really are.
Now that you said that.
No pressure. You really are. So,
and also, by the way,
yeah.
Once you join the course, you then we have special Q&As for those who are joining now. But once you join, you always get future Q&As.
That's a very good point. Right. So that's why I'm saying if you have been in the course in the past, you're getting 6 in 2022. And that's for people that, started with us in the course when we first launched it a couple of years ago.
Yeah. So people from several years ago are, you can keep coming.
Yes. You happen to get 2 special ones for the people who sign up right now. And it's a way to help you level up to people who've already been in the course. And that being said, it's like it's not competitive. It's just, we want to give you some baseline question time. So here's $200 off. You're getting those 8 live Q&As. This is just some of what the graphics look like. And that's my dining room where we tape part of it. And you also get the updates. You get the instant unlimited access, meaning that you don't have to wait for 4 weeks to get week 4 module. No, you're going to get the whole thing right away, which is the 36 lessons. The transcripts are professionally done and searchable, which is a gold mine. And then printable handouts, research studies so that you can take to your doctor, conversations that we've had on video, particularly for this course, about how to help you communicate with your doctor's office and your doctor. We do have that Facebook group that is amazing, and it's only $298 today. So we have it for you as inspiration and information. You also are getting the cooking classes. And this is my pretty picture of Dr. Siebecker. Okay, so that is an opportunity for you. And I know Clarissa has put that information in the chat box. So I want to check, is it in there? You keep posting it if you would, please. So thank you very much for allowing me to share that with you. But the reason why it's so important is that you need to sometimes guide your doctor, right? So that's why Dr. Siebecker created the Pro course as well. That is for professionals who are going to be dealing with SIBO patients. I tend to be the kind of overly enthusiastic person where I'm like, oh my gosh, I want to do the Pro or whatever, because I'm so into it. You will not be happy if you're a patient. Trust me, we've spent a lot of time making sure that the patient is right for patients, and the Pro is literally and truly for people who will be treating SIBO patients. Trust me on this one. So they're the same but different. How many hours is the Pro course, Dr. Siebecker?
22.
Okay. Trust me, you're going to want the patient one. So, and also the Pros are only getting 2 Q&As this year, and they're phenomenal. Don't get me wrong, but it's different. It's very different. So with that being said, please do not hesitate to join us, because the price is going to be going up shortly, and the time to really take your action and power is now. You're going to be getting master classes on adhesions, underlying causes, on mold, on SIFO. We really wanted to buff it out and make it very, very comprehensive so you would know what to do next, right? Because that is part of the huge dilemma and that SIBO panic that happens. All right, with that being said, and by the way, it's been so great to have so many of the students in here typing up nice things about the course. So feel free to keep doing that because we love it. And Dr. Siebecker, I would love to shoot some Q&As. You're the A's. Can I shoot you some Q's?
Yeah.
Okay. All righty then. So I'm not looking in the chat. I'm really not. The pro course does have a discount. It's $300 off right now, and Clarissa can give you a link, or you can, yeah, she'll put the, you know what, email us at info@sibosos.com and we'll give you the pro link. I don't even want to put the pro link in here because it's going to confuse everybody. So email us if you want the pro course. And it is also at a discount right now. Okay. So can one round of food poisoning bring your SIBO back?
Well, this is interesting. You know, what was the SIBO from originally? You know, if it was from food poisoning, then it's probably always there for the most part. Maybe not. Maybe you're one of the lucky that got to fully get rid of it. But if that was the scenario, I just want to make mention that there are a lot of studies on that people who have gotten food poisoning once tend to get it and get SIBO from it, tend to get it again. And that brings a relapse, obviously. And it's something that actually Dr. Pimentel has spoken about vociferously. He wants to do everything. He wants people who've had food poisoning to do everything in their power not to get food poisoning again. That is a concern of his. Now, let's assume that the SIBO here that this person's asking about is from something else. Yes, of course, this getting food poisoning could cause a relapse because food poisoning can cause SIBO. And we see this in a lot of cases, that when we go back in someone's history and we try to figure out what their underlying causes, we actually see multiple causes. And sometimes it's a little muddy because, like, well, maybe they originally got their SIBO from something else, but then they also have food poisoning and they got their symptoms from that again. And so now there's multiple underlying causes. And you know, Shivan, one of the reasons that Shivan has a chronic case is because she has multiple underlying causes, multiple incurable underlying causes. And so look at how great she's doing here.
I'm good.
Thanks for helping us.
I really don't want to pull out pictures of me where I was not doing well, but at some point I will drag them out and post in the Facebook group and all that. But it was bad. It was bad. I mean, I was really, really, truly, legitimately sick. I thought I had cancer. I cried and I begged and pleaded with God and the universe and spent thousands and thousands of dollars, did Ayurveda, acupuncture, rolfing, foot reflexology. I still love foot reflexology and all those things. But I kept thinking that was going to fix it. Whatever was wrong with me. I remember lifting my shirt up, no boob shot, but just like showing my belly to my personal trainer. I was on the treadmill, I was sweating. I was like, what is this? Because I was not fat, but this was big. And he's like, I don't know. Oh my God. You know, I was like, boinga, boinga. I was hitting it like it was a balloon. And he's like, I don't know. And
it was a balloon filled with air.
Yes, it really was. It really
filled with hydrogen and methane.
Yes, exactly. Exactly. So I'm very glad you all are here. Okay. Let's talk about the term stomach flu versus food poisoning.
Oh, yeah. So that's just another terminology. I mean, practically speaking, we have synonyms here for food poisoning. The medical term is acute gastroenteritis. And specifically here, we're talking about acute bacterial gastroenteritis. It's pathogenic bacteria that cause acute gastroenteritis, food poisoning and that cause SIBO, that go on to cause SIBO. So things like salmonella and Campylobacter jejuni. So the other terms are food poisoning, stomach flu, and traveler's diarrhea. Practically speaking, you know, there can be some medical differences here, but the reason that I'm saying this is because people will go, well, I didn't have food poisoning, I just had stomach flu. No, you need to consider that this is the same thing. And we didn't discuss this at all. We didn't discuss underlying causes except for me showing you briefly. There is a test that Dr. Pimentel created and validated to find out if food poisoning is your underlying cause of SIBO. And it is it's offered on TrioSmart, by Gemelli Labs. TrioSmart is the breath test, and it's called IBS Smart by Gemelli Labs. They also offer the TrioSmart, and it's a antibody test. It's a blood test. And then you get to find out if you have these antibodies, these autoantibodies against these aspects of really your nerve cells is what it is.
Very, very interesting.
And I highly recommend this test, because if you can find out that you have it, that you have those antibodies, then you know your underlying cause of SIBO, and you indirectly now know that your migrating motor complex is not working well. And then you know by a test for sure that you need a prokinetic to
Right,
help
so-
stimulate that migrating motor complex.
So what you just said there was gold. And sometimes people are like, well, if I find out that I have the antibodies, they don't have a cure for the antibodies yet. That's true. Dr. Pimentel's working on it. And some people get benefit from, like lion's mane, and Dr. Pimentel does say over time, some of them do just resolve
And
themselves.
Procalypride actually has some healing ability also on the nerves, on the antibodies and nerves, well, on the nerves.
And so, so when I finally did the test, which by the way, depending on where you live, you can, like, I went to a local blood draw place because they have relationships with labs around the country. And I found out that I was positive. It was the weirdest, most wonderful feeling to find out that something was wrong with me. Like, I actually finally knew the name of it. I knew that I had this post-infectious IBS. Which
I didn't mention that name. That's another name for
That's-
SIBO from food poisoning, is post-infectious IBS. It was called that years and years ago. In medical science, we've always known that IBS, not always, but for a very long time, that IBS can lead to long-term, that food poisoning, I'm saying it backwards, food poisoning, or, whatever other word we want to call that, can lead to long-term IBS. And that was called post-infectious IBS, meaning you had an acute infection, gastrointestinal infection, and then you got your IBS forever. That's post-infectious IBS. What Dr. Pimentel was able to do through years of meticulous one-by-one studies that I read, all of them as he was putting them out, was to show and prove that post-infectious IBS is SIBO. So, and then he developed this test.
Since I'm going back to the Q&A box, you guys can't look at the chat or I'm going to have a hemorrhage. So, okay, here we go. Let's see here. Thank you. All right. Oh, and yep, I answered you. Oh my gosh, you guys are talking to me. Right, got it. Oh my gosh, Ramona, got you. Ramona's a previous student. And because I'm in the wrong column, sorry. Ooh, that scared me. Those are the answered ones. Nancy has asked which prokinetic works for IMO, right? IBS-C, and when should it be taken? Which we have already addressed. Dr. Pimentel mentioned briefly online several months ago that taking it in the morning for constipation is helpful.
Okay, so here when I'm saying, throughout this lecture, I was saying SIBO, and I'm using the old terminology, that means EMO too. EMO, last webinar, I went over this in detail, but SIBO used to be it was called SIBO. And within that, we had the types, which included hydrogen SIBO, methane SIBO, hydrogen sulfide SIBO, and mixed. Methane SIBO, now there's a new word for that, EMO. So I just want to be clear, everything that I discussed in this lecture today applies to EMO because it's just methane SIBO. So there is no different prokinetic for EMO from any other type of SIBO and EMO. So all those prokinetics you can use. And remember, prokinetics are meant to stimulate the migrating motor complex overnight while we're sleeping. Now, what I think you're alluding to here is that some of our prokinetics in full dose, all of our prescription ones are taken, Procalypride, it's taken in low dose for SIBO and EMO. Okay, I'm just going to say SIBO. That means EMO right now in the way I'm speaking. But when we take some of these at full dose, in full dose, Procalypride has been studied for constipation. The dosing makes a huge difference, So you can use Procalypride in full dose, which is 2 milligrams. And the dose we use it for in SIBO is 0.5. So you can use it in full dose to affect constipation. And how you do this is up to you. Do you want to do this at night? Do you want to do it in the morning? And so clearly you were listening to Dr. Pimentel discuss a situation. I'm not sure what the details were in there, where he was recommending it in the morning. So there's a lot of intricacies here with I didn't go over dosing. I didn't, this
Yeah,
was a
there's
brief
too much.
lecture.
Yeah, and it was very long and good. So the other thing is, remember, like if you wake up in the morning and you eat, then you're not going to have that empty stomach. So, right. I like to take it at night because then I know I'm not eating in my sleep, hopefully.
For the
Okay.
prokinetic
For the
action.
prokinetic. Thank you. Yes, thank you. Okay. This is a really good question. It's not prokinetic oriented, but I think you'll be okay with answering it. Clarity on FODMAPs. Do FODMAPs, which are those fermentable carbohydrates, do they cause the growth of bacteria? Or if FODMAPs only cause symptoms to flare, but not actually make the bacteria grow? I get this question so often, Dr. Siebecker, and they're like, if I eat something, will it make my SIBO, well, worse, but will it, ultimately they're asking, will it make my gas levels go up?
I think it can make your gas levels go up right away just for a moment there because you've eaten. That would be the case with most things, right?
Right.
But the underlying question here is, are they going to worsen the situation? Are they going to make the overgrowth worse, right? That's the real question. And, I don't think we have any proof that is the case. I don't think we have any studies that show, well, if somebody ate a high FODMAP diet for a while, we tested their amount of bacteria and then their amount of bacteria afterwards. We don't have those kinds of studies. So I don't think we can say that. And I think the way I view it is that if it's not causing you symptoms, it's not causing you a problem. That is the way that I view it. If you can eat it and it's tolerated without any, the reason we get the symptoms is because of the gas, right? So we don't want to be making all this extra gas. That's the situation we have that's troublesome. But if you can eat foods and they don't create this extra gas, which you would know by your symptoms, when we have this bacterial gas or methane gas, it leads to the bowel movements symptoms, the bloating, the pain, the brain fog, the fatigue. It's all the symptoms. So if nothing gets worse, I don't think it's a problem. And I think you can eat those foods because it's very, very varied between each individual, what foods will trigger their symptoms compared to the next person. That's actually one of the hallmarks, I guess you'd say, of SIBO. And by SIBO, I mean emo too. I'm just a little tired today, so I'm reverting to my 12 years of vocabulary of SIBO. Okay, so when I say SIBO, I mean emo as well. To what we know about this condition is that the food for one person is horrible. And then the very next person, they could eat copious amounts of it all day and nothing happens to them. So I really do think we need to base it by symptoms. That's what I do. That's the way I think about it is if a food doesn't make your symptoms worse, I'm not concerned about you eating it. I'm just not. I'm not concerned that it's going to make your condition worse.
Okay. Thank you. What is the relationship?
Shivan, there's one thing I have to say over that. That
Sure.
in general, we judge that by the very day, whether you're having those symptoms on that day or not. But it's possible that over, say, like 3 or 4 days, now symptoms begin to really rise up. And so you would want to keep an eye on that.
Okay. That's a very good point. Right. Okay. What is the relationship between histamines and SIBO?
Oh, yeah. So SIBO can cause histamine intolerance, which is very unfortunate. And the reason why is because one of the enzymes that breaks down histamine, DAO, lives on the tip of the villi in the intestines. And so I know we were talking about this, I think, in the other webinar. If anyone studied the small intestine anatomy and microanatomy, we have the fingers and the hairs, and the fingers are the villi, and they're like a shag carpet. And it's that I'm talking about. These little projections on the tip of that is where we have this enzyme so that it's exposed to all the food that comes through in the small intestine. And SIBO can make that disappear. Basically, the damage in SIBO can make those go away. And then we don't have that enzyme. And then we're not breaking our histamine down, and then we can react to it and have this histamine intolerance. So it can cause it.
Okay.
Not in
Um,
everybody. I mean, not in everybody, but it can.
Right. So if your if your SIBO occurred from C. diff, what would your underlying cause be? Have you heard of that before?
Oh God, yeah. Oh my goodness, yeah. It's very
Common
common
that.
cause of it. Now, this is a little confusing for me because Dr. Pimentel and team have said that C. diff has the same, that bacteria has the same toxin that other pathogenic bacteria that are in food poisoning have. And so that really C. diff is like causing the food poisoning form of SIBO. But the issue for me is that I can't validate that because of the name of the toxin. I cannot be sure that that is actually true. So I can tell you that that's what they say, that the reason why it's causing it is because it's doing the same process as food poisoning, which means, because I haven't described this, is that there's a toxin that comes in during that food poisoning from the bacteria, and that toxin looks similar to a protein called vinculin that sits on our small intestine nerve cells, and which are called the interstitial cells of Cajal. And so what happens is the body mistakenly thinks, this is how autoimmunity usually works, the body mistakenly thinks that this toxin is well, actually, sorry, it confuses it and it thinks that it's the protein on our nerve cell. So it works against the toxin, but then it also starts to fight against the protein on the nerve cell because they look so similar. So it gets confused, and that is called cross-reactivity. So anyway, this is what Dr. Pimentel and team say is the underlying mechanism for C. diff, but I'm not able to validate that. I'm a little not sure that that's true.
Once again, this question comes up a lot, even in these last 3 trainings. Can you take Prokinetics during antimicrobial treatment?
Oh yeah, so I just had a slide on that earlier,
Okay.
and I addressed that question. So
Okay.
the answer was, I'm going to say it again, is yes. So what I was saying is that the general recommendation is to stop the Prokinetics during the antimicrobial treatment, but that it is fine to continue them, right? So you don't need to take them during antimicrobial treatment, and the general recommendation is to stop, but you can continue taking them. That is just fine. So you can do it either way.
Okay.
Yeah,
So,
I just want to be sure that people know that that is why I had that on the slide, because it is such a common question. So
common. Sorry for asking it again.
yeah,
But
no, it's good you did. It's good you did, because what if a person just, was drinking their water for a second and didn't hear it?
Right.
It's such an important question.
Please
Basically,
go back
don't
and
worry
watch the
about it.
recording. Yeah, don't worry about it. It's just expense, right? Like you've always said, if you depending on how expensive the medicine
Yeah,
is, that kind of thing.
but don't create more anxiety over it. It's fine either way.
Right. Okay. So there's 2 controversial questions. You've already answered one of them in one of the last trainings. And I am trying to keep this, so I don't mean to be a jerk by saying, go back to the second training. But if she covered something very thoroughly in that training, I am saying that because it's like flushed out. But here's the deal. Question. Anitra's doctor says that Prokinetics can be very dangerous.
Oh, such a good question. That is true. There are prokinetics that are not safe. And this is one of the reasons that I have focused so much for practitioners on training them in prokinetics, because there is a general correct prejudice from doctors that prokinetics are a dangerous category of medicines. But what they don't know, unfortunately, is that safe prokinetics are available. And that is what I showed you. And in particular, that is prucalopride. Prucalopride has just been like I don't know what, the godsend, I don't know what word to say, to gastroenterologists, because it is completely safe and it has all these beneficial qualities. Gastroenterologists have been trying to find a safe and effective prokinetic for a long time, and prucalopride is what that is. Erythromycin is also safe. It does have some concerns and issues, but those can be easily figured out and overcome. So, and then all of the natural ones are generally safe. There is a new warning on the label with Iberogast. However, Iberogast is that herbal combination liquid. However, I do just want to point out that Iberogast has been in use for about 40, 45 years commercially with, with no complaints up until just recently. And study after study showing that it was safe. So now there's a few little concerns, but I guess what I want to point out is that in the full spectrum of things, they're quite rare, kind of like with erythromycin. So I guess maybe what you would do is, it's so hard to communicate and say the right thing to the doctor. Maybe you could kindly let them know there are some Prokinetics newer on the market that are safe.
It's a fine line, right?
It's
The way that
hard.
you bring, it's hard, but you'll have to be a diplomat. Okay. So I was just reading a email from a person that I follow online, and his email was about small talk. And it was, oh, I'm not good at small talk. Well, okay, if you really don't think you're good at small talk, get good at small talk. It's not, it's not it's not out of reach. Communicating with your doctor and the front desk and the nurses, it's a job. Do not be intimidated. You are their customer, right? And it's a partnership. So I'll get off my soapbox, but don't be shy. I have been shy in those situations and regretted it. Also, be sure to walk in with that list, because you know what happens. Like, oh, I forgot to tell you something. I forgot to ask the doctor something. Oh my gosh, right? And then your appointment's not for who knows how long. It's very stressful. So we actually cover some of those tips and ideas in the course too, because you're not alone. And, if we can give you advice that saves you time, energy, and money, that's what we're all here for, right? Okay. So Marcy's asking about how long can you safely take Iberogast? I've been in SIBO remission for several months, taking Iberogast 20 drops and ginger 550 milligrams at night with great success.
Oh, good. I'm so glad to hear that.
Awesome.
I have had patients on Iberogast for a very long time. The company says you should only take it for 30 days. So, I cannot tell you it's okay for you. I can't give you medical advice and say it's okay for you to just take it forever. I'm just sharing. I have done that with my patients with success. The company does not recommend it.
So for people who cannot be on a SIBO specific diet because it significantly aggravates other digestive diseases due to low fiber, in her case, diverticulosis and several bouts of acute diverticulitis, what would you recommend as a diet strategy for post-treatment prevention stage and chronic SIBO?
What you can do is you can always add in partially hydrolyzed guar gum fiber, PHGG, to whatever SIBO diet you're doing, so that you can increase the fiber. The reason why is because, now I don't know that you'll tolerate it, but you can try it because that has been studied and showed to actually bring down methane. And I think it also brings down hydrogen. So we consider it like a SIBO safe, SIBO and EMO safe fiber. That doesn't mean it's safe for everybody. So you can start the fiber low, a fourth of what they recommend for a couple of days, and then keep increasing it slowly to make sure it's tolerated. But that's one of the things you can do. Also, there are SIBO diets that are, the SIBO specific food guide is the most restricted, which is why it gives the best symptomatic relief. But if you're doing well, you don't need to be that restricted. So you could do something like low FODMAP, which is actually not low fiber. They actually encourage fiber on the low FODMAP diet, which is why it wasn't designed for SIBO. So that would be a good choice. So you could look at that diet.
Okay. And what about the elemental diet, Dr. Siebecker? Like just to augment some nutrition?
Well, that won't give her the fiber. And, and I'm assuming that she knows that diverticulosis and diverticulitis is an underlying cause of SIBO.
So speaking of underlying causes, how do you test for Ehlers-Danlos as a chronic cause of SIBO? And could you define generally what Ehlers-Danlos is for people who don't know?
I'm going to let you answer that because.
Okay. Ehlers-Danlos is a hypermobility condition. Think Cirque du Soleil, but not that extreme necessarily. And being more extreme where people couldn't even walk. It's a collagen genetic disorder, if you want to call it that. I'm not a doctor, so I'm using my terms. But there's laxity that actually could move your internal organs so that the migrating motor complex might not be able to work because your physicality is out of position. I don't know. Is that okay?
I think you did a great job. And testing, I don't treat that condition. I don't test it. You go ahead.
Can you do this with your thumb? I can almost touch my thumb to my wrist. This is one of several different things that a specialist would take you through to see how flexible you are, but they're very specific moves.
I can tell you that it's called the Bite and Score, and there are handouts that I include for practitioners in our course and you can get them online of how to go through the Bite and Score. There's more tests than that, but that is something that you can start with, is the Bite and Score for Ehlers-Danlos.
Okay. So Karen, interesting question. Before obtaining a possible diagnosis of SIBO, would it be beneficial to start a prokinetic? That's part one of the question.
No, I wouldn't. I mean, there are reasons you could do that. It depends on what symptoms you're having. Prokinetics can be used to help treat symptoms. In full dose, they can help with constipation. In lower dose, they can help with various different symptoms. Also in full dose, they can help with gastroparesis, so the feeling that the food is sitting in the stomach and not going down. So, if you wanted symptom relief and you know all about that and you know how to do it in the dosing, yeah, you could. But that's not really what this is all about. What I was teaching about, really, it's for prokinetics. I think have two main uses. They can manage gastrointestinal diseases and certain symptoms. And then the other is to prevent SIBO relapse. So I just think, I would just get that test. I mean, I don't know how difficult it's going to be and how long it's going to take you to get the test. Oh, and by the way, we can pop in, if Clarissa has it, the Direct Labs link for where you can order your own.
That'd be great.
Yeah. But yeah, that's not the first thing I'd think of. What I would do is use the SIBO symptomatic relief suggestions handout. Go through that for helping symptoms until you get your test.
So Martha's talking about Iberogast and that it's not available right now. It does periodically go out of stock. I always do suggest going to eBay as well as Amazon, because I met a woman who worked for the Federal Trade Commission, and one of her jobs was working with to try to avoid counterfeit supplements. And she said that eBay actually had a good record of authentic supplements, because I guess they had problems in the beginning. So any suggestions for that? Do you just see it periodically come back, stock up, that kind of thing?
Yeah, I've seen that. And I've seen the price fluctuate. It's very frustrating.
Okay. Angela says, my SIBO is caused by medical misuse of pharmaceutical antibiotics. I really can't make sense of recommendations by my naturopath and others to take rifaximin and other pharma antibiotics. Can you explain why pharma antibiotics could help someone with my history? I should note that rifaximin was one of the 6 antibiotics I was taking that made me develop SIBO. So you definitely want to watch training 2. Yes, because that's where she talks about that. But did you want to make a comment on that?
Yeah. So first, I want to, just for everyone listening, say that antibiotics have been shown that they can. We knew clinically that antibiotics seem to be causing people SIBO. Clinically, we saw this a lot in reports from people. Too many people it's like, okay, there's something going on there. And then we had a preliminary study that showed that antibiotics, it wasn't listed which, can actually decrease the motility of the migrating motor complex that starts in the stomach and travels through the small intestine. So we know that antibiotics have, we don't know how, the ability to slow the migrating motor complex in some cases. Now, I would wonder if when you were on, it sounds like there were like 5 or 6, if I got that right, antibiotics that then gave you SIBO. I would wonder if it was really the other ones and not the rifaximin. Rifaximin hasn't been shown to do that. And it has so many beneficial qualities that I would imagine that's why your practitioners are still recommending that. I can't say that I know what's going on, but I also wouldn't feel that worried about using rifaximin, even in somebody that had gotten their SIBO from antibiotics, because we presume at this time that those are different. However, you can just use herbal antibiotics or elemental diet. And I understand why you would want to do that. Absolutely. So hopefully I've answered that. Did I answer all of it?
It's a lot. I have to keep going or
Okay.
everyone will
Hopefully
make
I got the answer.
it. Tammy has had help from a sour starter with white bread. So I guess she's had good results with sourdough bread.
That also brings down the FODMAP, the fermentable aspects when you use a sourdough starter.
Cooking onions and garlic does not deactivate the inulin enough, by the way. So we have had a lot of people ask about onions and garlic. So what do you tell people about onions and garlic to do when they want that flavor? And socially, it is really hard.
Yeah, so the recommendation which comes from the low FODMAP diet is that you use a garlic flavored oil. So it's like, you can also make it at home. You simmer basically garlic, sauteed garlic in oil, olive oil, and then you remove the actual garlic and the flavor is in the oil, or you can buy it pre-made, and you could do the same thing with onion. I haven't seen onion flavored oil, at least in my local stores, but you can make it yourself. I will say that there are people who are sensitive to even that. And usually always it's a portion thing. So a little bit is okay, but a goodly amount is not. So just start with that and see how it goes. And also, not everyone, I know this is crazy, but not everybody with SIBO emo is intolerant to onions and garlics, believe it or onions and garlic. So are you sure? Do you know that you can't have them? You know, it's okay to sort of try a little bit and see how you're doing.
What about Dr. Siebecker's chocolate cake recipe? Stay until the end and you'll get the link. And I don't blame you a bit.
And by the way, you know, the issue with those recipes is there's going to be a lot of people that can't handle that, who have SIBO emo, that it's going to bother them in their symptoms, because you have to find a flour that you can tolerate. And even, you know, the almond flour, some people can't tolerate that. It gives them bloating, you know, and then if you're going to use, are you going to be using those are gluten-free, those recipes, you know, but can you tolerate white flour? Or are you using gluten-free? If you're using gluten-free, like those recipes, then they have starch, and some people can't handle starch, powdered starch. So don't assume that you'll be able to tolerate them. And you shouldn't assume that for anything. Everybody's different with SIBO. You have to find your tolerances.
Okay. So what is the role of H. pylori? Can I afford to ignore this pathogen? Should I choose to be a carrier if I cannot eradicate H. pylori? How do I check for peptic ulcers? So what is, I think the one that's going to be most helpful for everybody in this is, how does H. pylori interact, or is it a cause of SIBO?
Yeah, it has been linked. It has been linked with SIBO. I wish so much we had Dr. Sandberg Lewis here to answer those intricacies. He's an H. pylori expert. But I do know that it is linked. And but not always. So there can be forms of H. pylori, states of it, carrier states, that do not lead to SIBO. I think it has to do with the virulence factors.
Okay.
That come from H. pylori. Not all H. pylori releases virulence factors.
Okay. From Judy. Oh, Judy, I had a concussion and I think that is what caused my SIBO. What's the brain gut axis connection with SIBO?
Yeah, so traumatic brain injury, TBI, concussion would be under that heading, is a cause of SIBO. There's secondary circumstances that can happen in some people, not in all, that lead to inflammation and then a decrease in motility, including the migrating motor complex. So it's basically a top down, a brain down situation where the controls are not occurring to make the motility happen. And unfortunately, that is one of the causes that we don't know how to reverse at this time.
Yeah, right. That it is very, very tough. And we have some interviews in the SIBO Facebook group with Dr. Shivan Sarna Lewis's wife, who is a specialist in this. And it's Kayla. Is that how you pronounce her first name? I always get it wrong. Yeah. Even though I love her and know her, and I feel. And like
also, I would also say that the Next Steps Summit has potential, you know, has treatments that potentially we hope could help.
Whole another conversation, but we do have, so Dr. Siebecker and I in the course talk about, have you tried everything? And it's very easy for all of us to feel like we have tried everything. right? But have you really tried everything? Have you gone through that whole list of the prokinetics and all the different antimicrobials, et cetera? And Dr. Siebecker, a lot of people are asking about, can you combine prokinetics?
Oh, yes. It's actually one of my key points that I did not include in this lecture.
Okay.
I combine them all the time for people in various different ways. I'll use, Iberogast doesn't have ginger, so maybe I'll use Iberogast with ginger or ginger containing prokinetic. I use either of those with LDN, because LDN sometimes isn't strong enough for people as a prokinetic. So then I'll use Iberogast or one of the gingers with it. For the toughest of patients, I'm using prucalopride and low-dose prucalopride and low-dose erythromycin, one at night, one in the morning.
From Mary, I have Hashimoto's and chronic IMO, well managed last few years through herbal antimicrobials, low FODMAP diet, and prokinetics. I've been taking LDN and Iberogast for more than a year. Great benefits. Awesome. Do you recommend periodic liver function tests for long-term use of these prokinetics? And in particular, I think the particularly big issue that I hear about is Iberogast, because that's on the label.
That's right. I think that's an excellent idea. Excellent. I do recommend that.
Yeah.
Good call.
Okay. Let's see. Okay. I can never pronounce this one either. I was diagnosed with collagenous. Okay. Colitis. Is this an underlying cause for SIBO?
I think it could be. I'm not sure we have studies on that yet, to my knowledge, but certainly a lot of physicians consider this under the heading of inflammatory bowel disease. Others don't, but we know inflammatory bowel disease can be an underlying cause for SIBO. So yes, I think it could be.
So you and I were just talking about a new study that came out about the low FODMAP diet. There's some controversy around this diet, that it inhibits the microbiome diversity. And yet, what did the study say?
There's conflicting studies, and not everybody knows that, actually. And the one you're referring to that just came out showed that it actually enhanced the microbial diversity. So we have studies saying that it hurts and studies saying that it helps. So it isn't, there isn't one answer here. Whenever that happens, it's very confusing, right? What are we supposed to do with that information? One says black, the other says white, right? So it becomes more complicated. And usually what I think that means is it depends on the situation, the case, the patient population. And I don't know what the answer is here yet, but basically, I guess what I want to say is, if you're following the diet as written, I am not that concerned about it. And also, if you are checking to see if you can expand your diet, then I'm not concerned. If you're just being super restricted. And I also want to say one more thing. What if you can have no symptom relief unless you can be very restricted? There are people in that circumstance that have multiple underlying causes that are severe, and these people are near disabled, and they have to be, some of them are not, they have to be extremely restricted on their diet. I don't want anyone like that feeling like you're doing anything wrong. You have to do what you have to do to get through your life, so we have a varying degree of situations here. But I guess what I wanted to speak to is, I always want to encourage people to try to expand their diet when they can, because that's how you can not be as worried about microbiome.
Right. Okay, Todd is asking about lovastatin for methane types of SIBO. My GI doctor doesn't seem to know about this. You want to give them an update?
Yeah, so Dr. Pimentel has been using this for a long time. He even actually began with using pravastatin. The statins, which are used for cholesterol lowering, they actually have the ability to inhibit the production of methane gas. And so Dr. Pimentel used these in clinic for a while, and then he developed a form that would deliver like lower down into the digestive tract, so it would stay in the intestines and have this gas inhibiting effect better than just getting absorbed into the blood. And he did a study on it, and he told Shivan and I, he said he was initially having great results, but then he told Shivan and I on an interview we did with him about a year ago that actually the final results came back where it was sending him back to the drawing board. And we haven't really heard anything since that time. He was doing trials on it. I was helping advertise for his recruitment. But then he said, we have to go back to the drawing board. So we'll have to see what happens from that. There is an option of trying low-dose lovastatin or pravastatin to see if that helps you. And Dr. Pimentel has been doing that for years.
From Joyce, I just finished 1 month, 2 weeks of Cipro and Flagyl, and continued Cipro and switched to clindamycin. Did I say that?
Clindamycin.
Yeah, it's a good thing I'm not a doctor. Because although I do have terrible handwriting, so I would totally qualify. Yeah, unlike you with perfect handwriting. Okay, so she had switched to that for another 2 weeks, had 90% improvement, had no improvement with 2 rounds of Xifaxan. But just 1 day later started feeling a gas pocket high, very SIBO-like, and felt worried that was already coming back. My doctor said it's impossible for the bacteria to grow back that quickly, and perhaps hyperanxiety as a role. We'll start LDE tonight.
That's low-dose erythromycin.
Okay, right on, right? But afraid that I needed another month of broad spectrum antibiotics.
Yeah, so this is what we call a rapid relapser. It's a thing. It has a name. In fact, it's even been put in a study. And when that happens, I suspect 2 things. One is what you're thinking. Maybe you weren't completely finished with, even though, because you can feel better, but still have a little bit, more to go. The overgrowth is still somewhat there. I'm wondering if you had a retest that would, help. Maybe you did. And the second thing I think about is a structural underlying cause when there's such a rapid relapse, something that, like adhesions or some kind of compression that is going on. And I wonder if you've looked into that at all. The best test, the one that Dr. Pimentel recommends, is a barium swallow. Many people have heard of a barium enema, but this is drinking barium. And then we get a series of pictures, but we do need a lot of pictures, and it needs to be lots of pictures as that barium moves through the small intestine over several hours, usually at least 2. And the reason I explained all that is for anyone listening who is interested in getting this test or talking to their practitioner about it, you do need to include that type of description of how to perform the test when you order the test, because otherwise the radiologist will take like 4 pictures. So it has to be special instructions as you order that test. So anyway, that's what I would think of. I would see if you could get a barium swallow if you haven't already, and or you could have needed another round of antimicrobial treatment.
Okay. Let's see. Does the bacteria of hydrogen dominant SIBO go dormant or die if not fed?
Say that one more time.
So does eating food feed the bacteria? There's some terminology that I think gets really confusing for people.
Okay, and can you read the question one more time?
Does the bacteria of hydrogen dominant SIBO go dormant or die if not fed?
Well, I suppose that might be true. Well, they can go dormant first, but then the idea would be that they would die after going dormant, because that is the principle of the elemental diet, right? That's the principle there. So starving the bacteria, but then feeding the patient. But the problem is we don't really have a very good way of doing that without doing something like an elemental diet, because you can fast, but and people have, and we have some case studies where all you're drinking is water, right? Like it's a medical fast, but that's difficult, and you should probably be under supervision, because you really need to get what Dr. Pimentel has said is, even with elemental diet, you need to get to at least about 10 days before you can reliably think you're going to be able to do the killing. So the problem is we can't really do it while eating very well.
Okay.
Like with the SIBO diet, that's not enough. We need something more extreme.
Okay, so I just got a question about the SIBO Recovery Roadmap, just real quick. We're doing a commercial break here. So this is the this is what it's going to look like. Well, here's some testimonials. So I'm so glad I trusted my instincts and signed up. There's been so much offered and has been so useful. That price now seems like a very small price to have paid. A big thank you. Thank you, Maya. I made my decision to buy the course because the cost is the same as about 2 visits with my doctor. And even though I get a one-on-one time with her, I have so far received way more than 2 visits worth of information from all of you. And I've barely scratched the surface of what has been offered, Barbara. Thank you, Barbara, for that. So you will know what to ask for from your doctor. You'll have the right labs to ask for. You'll know what the dosages are and that have been studied, the brands of herbs. I mean, we are like in your dining room too, going through everything step by step. The timing, which is so important. It's now $298. There is a payment plan available. I just look at it, it'll tell you. And the price is going back up way before the end of the month. I can't remember the date right now, but you want to do this right now. Oh, anybody who signs up during the webinar, I didn't mention this earlier, will get a PDF of my book, Healing SIBO. And what's really nice about that is that you can search a PDF, right? So the transcripts are searchable as well, but it's nice you're getting that as a bonus if you do sign up during this webinar, and Clarissa's been keeping track, etc. So you get those 8 live Q&As. We have never done that many before. And frankly, we will probably never do that many again. It is constantly updated when it's appropriate, you know, with new information, not just to overload you with more overwhelm, but when it's really a pivotal, essential part of an update, Dr. Siebecker puts that in. We actually use restraint in not putting too much information in the course because it can be so overwhelming and it feeds panic sometimes. So, oh, I learned about this. I learned about this. Well, that's cool. It's great. But when you're in that state, it's sometimes just, that's what we call it, the roadmap. Stay the course, stay the course. The 36 lessons, all beautifully professionally edited. And you do have instant access to all of it. And it really is your partner. And remember, if you've participated in the course before, enrolled in the course before, you are this year getting 6 Q&As. So that's an example of what we are committed to doing with you, is keeping you in the loop and supporting you into the future. And so we didn't do a lot of Q&As last year because Dr. Siebecker was working on her book, which she's still working on, thank you. And so we wanted to kind of make up for it this year, but also invite you to join us with that support throughout the year. And it's 1 a month, means during 8 months of the year. I think we take a break here and there, but you can also pre-submit your questions if you can't attend live, and you'll get the recording and you'll get a searchable transcript of the Q&As. So plus you get the searchable transcripts of previous Q&As. So it's very cool. This is what the checkout thingy looks like. Is that the right one? We're gonna, yes, it is. Okay, great. And I just wanted to show you so you have some familiarity with it. Then you have your login page. This is what it's going to look like. You get into a portal where all the information is kept. It's very organized, big time. It's not like you're going to have to be searching everywhere. And then that's an example of the transcripts right there. And then this is the, you can start with your first lesson and proceed in the order to match the 9 proven steps. So that has to do with the algorithm that we showed you earlier. You can pick and choose. It's totally up to you. And don't forget about that Facebook group. And then this is going to be your login, and it's super straightforward. This is where I just want to let you have eyeballs on this so you can see what it's going to look like when you get in there. And then this is what the course looks like. Types of SIBO, notice the word updated. So at some point we'd been updating frequently, and then to help the people that were already in the course, if it had been in there for a long time, we removed the word updated. So we're sort of, keeping you posted, but also trying not to overwhelm you at the same time. Hormones and finding a good hormone doctor, sleep, bloating, the symptomatic treatment for it, nausea, definitely important, although not a huge factor of SIBO, as Dr. Siebecker mentioned, but we wanted to address it. And notice some of them are really short. Some of them are nice and long, but they are organized, extremely organized and not overwhelming. Very important part of our approach was to not have it be overwhelming. And just to pull it all together for you, this is the algorithm that it's based on, which Dr. Siebecker showed you earlier. And remember, you have those clickable links from the algorithm to the lesson. So for example, here's a lesson on constipation. Did that pop up?
Yes.
Good, thanks.
Oh, wait, the
And-
lesson on constipation hasn't popped up, just the algorithm.
Stop share. I don't know. I'm sure there's a way to do that, but I'm just going to do this instead, share. So this is constipation. Yeah. It's 20 minutes and it talks about food and probiotics. When you're enrolled, you can click to download the material, symptomatic treatment. You get the idea. This is literally what it looks like. There's the lesson. Here's the transcript, and on and on. So I've taken courses before, and there's even the yogurt recipe. I've of course taken courses before and online, and they were like, yeah, they're okay. And some I was dissatisfied with, and a few I've been really happy with, but we really wanted to make sure you're going to be happy. So we really pulled out all the stops, and we're very much in sort of fantasy dream mode about, well, what if we could do this? And what if we could do this? And the reviews have been fantastic. So I just wanted to share with you that, this is a tried and true method. It's been validated, but it's also a tried and true course. So you are not alone on this quest. And then all those Q&As, which is so nice. Okay, back to the Q&A box I go. So if it's a question that Dr. Siebecker covered thoroughly in the program, I'm just skipping over that because again, we will be here for all day. And I'm trying to get as much diversity and also answer some questions from people who haven't had answered questions before. Okay. Moving along here. Okay. So the microbiome is getting, the question is really like, what can you do to expand your microbiome? We just talked about the low FODMAP diet. What about gluten and dairy for SIBO patients?
The issue with dairy is really the lactose sugar, and a large amount of people with SIBO emo become lactose intolerant because of SIBO. SIBO will cause it. And then once we go through the antimicrobial treatment, then usually you can tolerate the lactose again. Now, separately from that, some people just have an allergy to dairy proteins. So whether that's whey or casein. And so that's a separate issue. And that's not, SIBO doesn't cause that per se. And so we wouldn't necessarily expect that to go away when SIBO goes away. And one other thing is that sometimes people have genetic lactose intolerance. They may not know that they have that. And so then they may think, oh, well, the SIBO caused it. Because some people they've had these symptoms for so long, and then they identify SIBO and then they think, well, maybe it'll get rid of my issues with dairy, but really they have kind of two things going on at once: genetic lactose intolerance as well as SIBO. So then in that case, we wouldn't expect that to get better because they had another condition. And then the other one that you asked about besides lactose was gluten. That is a separate issue from SIBO. We don't expect that to resolve when SIBO resolves, and SIBO doesn't cause gluten intolerance or celiac. So they're separate. I mean, there's interactions, but
Right.
SIBO doesn't cause that. It's what SIBO's issues with food are about the microbes fermenting carbohydrate foods into gas, so they can ferment grains, including the FOS that's in wheat. That's not the gluten, it's the FOS. And then that causes gas, and the gas causes symptoms.
Okay, there you go. So what is the villi produced enzyme that SIBO destroys and triggers too much histamine? Is it DAO?
Yes, that was DAO.
Okay. How is SIBO related to leaky gut?
SIBO can cause leaky gut. And the studies show about 50% of people with SIBO will get leaky gut from the SIBO, which is, I think, astonishing that it's not everybody. It's good news. It's not everybody. And what the studies also show is that once the SIBO was eradicated, they used antibiotics in the study, they eradicated the SIBO, they had negative tests, then the leaky gut clears up in a majority of people, 100% in one study, I think around 70% in the other study. But with that 70%, what I always like to remind everybody of is there are a lot of causes of leaky gut. And so for some people, they may have more than one. I think a lot of people have more than one cause that could be causing leaky gut. But certainly getting rid of the SIBO will be a big benefit.
Okay, cool. And that answered a couple of people's questions right there. More about garlic, which we talked about. Can prucalopride trigger MCAS?
Not to my knowledge.
Okay.
But there might be something this person has read and to make them think that.
They reacted to VIP for mold and LDN with tinnitus, and we think it's an MCAS issue.
And they reacted to VIP?
I don't know what VIP is.
They
but
reacted
a lot of
to
people
VIP with...
Yeah, and a lot of people use LDN for MCAS, don't they?
Sorry, I was still thinking about the VIP. I
Sorry.
wonder if she meant LDP, like low dose prucalopride. So sorry, go to your question.
I reacted to VIP for mold and LDN with tinnitus, that ear ringing, and we think it was an MCAS issue.
Fascinating. Yeah, I can't comment on that. You know, potentially was the LDN, what was in the LDN? How was it compounded? Was there something?
That's a great question.
Yeah, but for low dose prucalopride, I haven't heard this. But that is, so I would love to know their thinking of why they're thinking that that could be an issue. Maybe it's just because LDN, but LDN and prucalopride have completely different mechanisms of action. They activate different receptors in the body. They're very, very different pathophysiologically than from each other. So if the concern was the LDN, well, then maybe another prokinetic, that I think that would be unlikely because they're so different.
So let's talk about the ileocecal valve for a minute. We haven't talked a lot about it in the training, so I don't think we've talked about it at all. And what is that theory or thought pattern about the ileocecal valve and SIBO? So somebody was saying that they went to their doctor and they felt that it was the backwash from the ileocecal valve causing their overgrowth.
Right. So this is a concern. You know, the ileocecal valve is the valve that is the end of the small intestine. It is what forms the back door, the end bottom of the small intestine. And then we start the large intestine afterwards. And normally it would be closed. There's times when it opens, you know, to let things pass through. So the thought here is, what if somebody has a lax ileocecal valve so that it's just sort of always open? Then couldn't the microbes, the huge amount of bacteria and microbes that are in the large intestine, just come through that valve up into the small intestine? And there are two studies to show that when there is a poor tone or laxity of that valve, that there's a higher likelihood or risk of SIBO. So there is some thought there. But what's interesting is that we really know that the migrating motor complex is the primary thing here, because the migrating motor complex works like a river, and it has a downward current, always moving and pushing down. And so really the issue here is the migrating motor complex, if it's not pushing down, because if the valve is open, it should be able to still push that bacteria down. And how we know this is from studies where people have surgically had their ileocecal valve removed. And we know that we would think, wouldn't everyone just get SIBO? But really what it looks like is they only get SIBO if the migrating motor complex isn't then working. So what I think is going on in most of these cases is the ileocecal valve may be lax, but that wouldn't matter probably if the migrating motor complex was working well. So probably what's going on is this person also has a poor functioning migrating motor complex.
Okay, we are overwhelmed with questions, and I thank you all so much. Listen, you want to stay just 5 more minutes, and then we will get you that link for the recording and for the handouts. But I want to just make it a little bit juicier now for those of you who are on the fence about signing up for the SIBO Recovery Roadmap course. So go ahead, Clarissa, and get that link ready to post in the chat. I know you have been. but we have some master classes that will take you further about MCAS, for example, about mold and SIFO. And what I want to do, which my team is not familiar with, I'm just going to make them crazy. Sorry. $201 off, 2 extra live Q&A. So it's a total for 8. You're getting the cooking classes, which I haven't even really talked about, but if you're hungry, believe me, you'll be thrilled with those. Those of you who signed up during this session are going to get a PDF of my book. Don't tell the publisher, it's fine. And what I'd like to do is offer anyone in the next 5 minutes who picks up the course a gift certificate to one of the master classes. Now, this is a nightmare to fulfill. That's why I'm only doing it for like the next 5 minutes before we end. So starting the timer, it's 1:55 Eastern time. Anybody who picks it up between 1:55 and 2 p.m. Eastern, I know it's a small window, but that's because it's such a nightmare to do. This is literally hand fulfilling. We have fantastic master classes about these other topics like mold, like SIFO,
MCAS, Ehlers-Danlos.
Ehlers-Danlos, thank you. We also have it on bile and biofilms. So if you want to go for it, go ahead.
Probiotics.
And, probiotics. Oh my gosh, a great one on probiotics. Just sweeten it up a little bit. Last 5 minutes, want to do a big old motion here, a big old MMC wave. Thank you to get you off of the fence and making that right decision for yourself. We really appreciate you. We love you. I know that sounds crazy and weird and woo-woo, but we do. That is our heart and soul, is that we are here in service, and we want to greatly contribute to you being better and well. So sometimes we have to save ourselves, and that's certainly why I have SOS as part of my whole branding. And it used to be, let someone save me, like I was just like victim, but I transformed that mentality and existence when I followed Dr. Siebecker's work, when I followed the algorithm, and I transformed my health by doing exactly what we've been talking about here. And everyone's obviously different, but that's why there's so many, thank goodness, variations. Wouldn't it be a bummer if SIBO /IBS/IMO, there was only one thing, and if it worked, it worked. If it didn't, it didn't. What if it was just the elemental diet? And good luck to you, right? That would suck. That would be such a bummer, right? And thank goodness Dr. Pimentel, who I pray for every day and like twice a day, is doing such beautiful work. I do believe he'll be the one to cure us, like as in like cure. And I hope it happens soon rather than later. I know he does too, but this is a beautiful, beautiful process that really does work. Dr. Siebecker didn't discuss today how it's been validated by her and Dr. Stephen Sandberg Lewis at the SIBO clinic that does not exist in its same form anymore, but that they did thousands of before and afters with this format, with this protocol before the treatment rounds and after, and they were validated that thousands and thousands of people got better. So this is not a guess. This really does work. And yeah, you may have some other things going on, but in order to get those gas levels down, this is validated. So I think I just want to really impress that upon you, because it's hope, but it's also reality. It's also reality. Any final words, Dr. Siebecker, in the last 2 minutes?
Oh, I'm just so glad you're all here. It means, you know, you're taking this information and information and knowledge is power into your own hands. And I want you all to know that there really is hope, that we see so many people feel better. That is the norm. It is the norm for people to get and feel better.
All right. Thank you so much, Dr. Siebecker. I'll let you go. We are finishing on time, and I'm not going to be able to go into the brainstorming session in another Zoom room today because I have to take my mom to a heart doctor. So my godmother, we had a little scare, and we're going to go find out what happened. So fortunately, she's doing much better. So anyway, thank you so much. We really appreciate you. And thank you, Lena. I appreciate that. Big time. Yep. Pop some love in for Dr. Siebecker. She loves reading them. And when she feels like, oh, this is so much work and it's so expensive and it's so much, well, she does have a really strong internal why. I do love that when you guys write nice things and she reads them, she does like, oh, look, they were helped. Oh, look, you know, we do, of course, we're human, right? We thrive off of that. So we do have a small team. We are, as you know, working diligently to get your questions answered offline in our ticket system. And hopefully, oh, Clarissa, my gosh, put the links in for the handouts. Thank you. She's done it. And for the recordings. That's one of the reasons why I'm also stopping right on time, is because that allows us to let Zoom process and get the recordings out to you sooner, because we go from Zoom to Vimeo and it takes a little time to have those process. Oh my gosh. Wow, Lynn, when you say things like that, that just really warms the cockles of my heart and my soul. And I will share that with Dr. Siebecker. She's saying that she was considering something very serious. I have had people in the Facebook group talk about suicide on occasion, and it scares me, and I want to support them however I can, but I'm not skilled in that. And so it's a very fine line. But if you've ever really felt like, how can you go on, and whatever that spectrum is, right? Because it is a sliding scale. I just want to really let you know that we take it very seriously. This is a session of hope. There are answers. Of course, we support you working with your medical providers. Cool that we can do a lot of it DIY, but look, you could inspire someone else to get well. How would that feel? That would be amazing. You all have missions on the planet, whatever they are. I really feel this way. Whatever it is that you have to do on this mission, on this planet, in this lifetime, you are needed. You are super important. And I would hate to see you suffer one more day without the information that you need to be well, because that is a tragedy to me. That is a total and utter waste of life. And if you know me, I hate wasting food and I hate wasting opportunities in life. I have been very blessed with multiple careers. I have had my ups and downs like anyone else. I've been bullied by corporations and bad executives. I've been beloved by them, by corporations and executives. I mean, I've really run the gamut. And I've had lots of money. I've had a little money. Doesn't mean, I've had all kinds of things. Both my parents died at an early age for me. I was born when my daddy was 69, believe it or not. And my mom was 30 years younger. She passed from cancer in the 90s. And so, we all have our stuff, right? But I just don't want this to be another thing that is part of your stuff that holds you back. So if that resonates with you, I would really love to see you in the course. At the very least, join us in the Facebook group, but we are here for you. And thank you very much. Okay. Love you. Thank you. Woo. Let's see. All right. Thank you so much, Clarissa. Grab those links, guys. Thank you so much. Linda, you're at 156. So you are in for one of those master classes. Give Clarissa like a week to get to you. We definitely have you documented, but like, she's going to kill me. I'm so sorry, Clarissa. I just wanted to do a little last minute sort of, get out the paddles. Let's do this together and get you where you need to be. Thanks, Michael. Thanks, Stephen. Thanks so much for you all around the world. Yep, all around the world. Thank you very, very much. Great. Love to you all. Okay. All right. Now I am going to turn it off, and here's why. Because the sooner I turn it off, the sooner we will get the recording to you. Well, I would love to continue to read all those things. Thank you. Thank you. Thank you. I'm going to say goodbye. Okay. I hope to see you all in the 8 Q&As in 2022. And I don't know when we're relaunching it at the special price. I truly don't. That is not a gimmick or something. This week, honestly, I'm going to stop the recording. Thanks, everybody.